Hello. What is health psychology? Health psychology concerns all psychological processes that are direct or indirect causes or effects of physical health or physical illness. But these processes are embedded in a context. Healthy people want to stay healthy. They influence their physical health through behaviors. They engage in unhealthy behaviors such as smoking and binge drinking. Or they do not engage in healthy behaviors such as healthy eating and getting sufficient physical exercise. These behaviors are governed by psychological processes. In addition, stress, which is largely caused by the psychological meaning given to events, stress can also harm the body. When people have an illness, they have to adjust their thinking and behavior to maintain quality of life and stabilize or lower the negative consequences of their illness. They have to adhere to medical treatment, take their pills, visit the doctor, change their lifestyle, such as following a diet, arrange their social support, cope with limitations, suffering, and sometimes impending death. This is all psychology. Health psychology deals with these psychological phenomena. However, the psychological processes are embedded in the social and physical world, and specific states of or changes in these external factors may have typical psychological and behavioral effects. Therefore, to know health psychology, it is important to know about these external factors. To understand people, but certainly when we want to influence people's thinking and behavior, we need to know about the context of human psychological processes. The context refers to the factual physical reality that surrounds the individual. People have mental representations of this reality that govern their behavior. However, it's relevant to know whether these representations are true, whether they are valid. A health psychology must have basic or advanced knowledge about the relevant factual reality. The factual context can be divided into the social environment, the close physical environment, the body, and the distant physical environment, the external environment. Firstly, there is a relevant social context. It makes a difference whether only 2% of the population engages in a certain unhealthy behavior or 39%, or whether only 23 patients have a certain disease or 300,000. This factual reality shapes and explains how people perceive a behavior or an illness. For example, the fact that still about 25% of the Dutch population smokes is essential to understand how the government can tolerate an unhealthy product such as tobacco. In addition, this population state explains the state of the physical environment. For example, the number of selling points of tobacco, which in turn also may influence people's thinking and behavior. With regard to illness prevalence figures, they are also relevant because they influence people's perceptions of the illness. The more people have an illness, the more the illness seems common, like diabetes, and the less serious it might seem. The high prevalence of an illness also signals whether the healthcare system is prepared to diagnose and treat the illness adequately. Thus, to get a full understanding of how people think about their own and others' behaviors and illnesses, these epidemiological data are essential. For example, these graphs provide figures on smoking behavior and on the percentage of overweight children, both over decades. They are related to how the problems of smoking and overweight are perceived and how society may have adapted itself already to these problems. Second, the close physical context concerns the body. Unhealthy behaviors have negative physical consequences, and among other things, it is relevant to know what exactly is unhealthy. For example, about eating many pizzas, and whether the effects of unhealthy behaviors are immediate or postponed, and visible or not. Therefore, it is important to understand the basic physical mechanisms. For example, a smoker might say that he has reduced cigarette consumption with 50% and therefore feels relieved from the fear of getting lung cancer. A health psychologist must know whether this is true or not, whether this belief is a disengagement belief applied to reduce dissonance and fear, or whether this is a realistic strategy to reduce harm. Also, smokers may worry about the negative consequences of smoking. Is that rational? Here you see a map of the negative physical consequences of smoking. And maybe in the 1 in 5 smokers who get lung cancer. This depiction of the stages of lung cancer may become important to understand the smoker's situation and experience. Thus, knowledge on what is exactly unhealthy about smoking, on how and to what extent condoms influence the risk for STD, and what levels of physical exercise are healthy for what, can be important. To understand this type of knowledge in depth, it is important to know about the basics of physiology and organ function. For example, to really understand what it means that the liver can be damaged by alcohol, it is good to know what the normal functions of the liver are and how this relates to the whole body physical functioning. In addition, physical pathological processes have their objective manifestations, like a fever, and give different physical symptoms that are experienced. There are different types of symptoms and physical states with different durations and manifestations and consequences. And patients develop their expectations about their illnesses and future partly on the basis of objective physical states and functions. Therefore, to completely understand people's reactions towards an illness, it's important to know what people are or can be exposed to. Patients may have beliefs about their illnesses that may be true or not. For example, a patient may think that specific symptoms are good indicators of the underlying pathological process. It is important to know whether this is true or not, whether the symptoms are interpreted in the right way in order to guide the patient's behavior. Also, when a patient does not take his medicine because he thinks he will get addicted to it, it is important to know whether this is true or not, to know whether this specific medicine has an increased potential for getting addicted. Thirdly, the distant physical context concerns the physical environment. The state of the physical environment may also influence how people think and behave. For healthy people, the opportunity to make unhealthy choices may be relevant. Factors such as prices and availability, the number of selling points, are relevant here. Also, the physical environment can stimulate or inhibit physical exercise. For people bound, for example, to their wheelchair, the accessibility of public buildings is relevant. And for patients, the healthcare environment, such as waiting lists and medicine costs, may be relevant to understand their situation and their reactions and to develop solutions with them. Also, the treatment as a context may be important to know. To understand the patient's thinking, experience and behavior in reaction to a treatment, it is important to know about the actual treatment. For example, how complex is blood sugar monitoring and self-injecting insulin? And what is radiation treatment? Does it take long? Does it hurt? Thus, epidemiological data and knowledge on basic physical processes of exposure and manifestations of pathology and of societal and healthcare context are important to get the full understanding of health psychology. In practice, it is not necessary to know all of these areas, but one can zoom into an area when needed. For example, when getting to work with chronic pain patients, one can study the prevalence of chronic pain, the physical causes of it, the availability of medical treatments, the pathophysiological mechanisms, and the laws, rules, and assurance consequences. And when getting to work with obese patients, the precise definitions of obesity, the epidemiology, the physical consequences, how people can get obese, the contemporary physical environment, and the medical treatment as solution can be studied. When designing interventions, the context should always be considered, and often inducing changes in the context must be part of a health psychological intervention. For example, smoking cessation may be supported by nicotine replacement that influences the physical body. Living with chronic pain may be supported by a stairs elevator. Preventing alcohol abuse by education may be supported by lowering accessibility to alcohol, and informing a population about the dangers of obesity may be accompanied by infrastructural changes in buildings and city planning. Thus, health psychology is about the human psychology in a physical world that's partly shaped by policies. This must be acknowledged in the theory as well as in the practice of health psychology. Bye.